Dr. Ruma Das is going to speak on pattern of ocular injury during agricultural work in a tertiary care center of Assam.
A very good morning to all. I am Dr. Ruma Das from Silchar Medical College, Assam. So my topic is pattern of ocular trauma in agricultural injury in a tertiary care center in Assam. So ocular trauma is one of the main causes of severe ocular mobility. Decrease of loss of vision, either monocular or binocular, may result in significant economic burdens to families and countries due to time lost from work or school and family caregiving, expensive hospitalization, special visit and treatment, prolonged follow-up, and visual rehabilitation. So, in Assam, in rural Assam, almost 70% of the people are in agriculture, either in farming, livestock rearing, and fishing. So, we have a study from 1st January 2023 to 31st January 2023 in Silchar Medical College, Assam. So, our type of study was a prospective observational case series study, and written informed consent was taken from each patient on printed form before examination was done. So, visual acuity of each eye was measured by Snellen's chart or Landau's C chart or E chart as appropriate. In patients with poor vision, gross assessment was done by counting fingers at specific distance, hand movements, perception of light present or not, projection of rays accurate or not. In infants, fixation of light and smooth pursuit was assessed with a torchlight. In few cases, pinhole acuity was taken. Ocular motility testing and orbital rim tenderness was done in all patients. Comprehensive anterior and posterior segment assessment was done for all patients. The globe was examined for any laceration, luxation, rupture, any intraocular foreign body, any exophthalmos, anophthalmos, and phthisis bulbi. Any conjunctival foreign body, tear or laceration, subconjunctival hemorrhage and discharge were noted. Corneoscleral injuries, particularly foreign bodies, abrasions, cut injuries, edema, ulcer, etc. were also noted. The posterior segment examination was done either with undilated pupil or with dilated pupil as situation permitted. A direct ophthalmoscopy examination and also indirect examination was done. So, coming to the results of our study, in this prospective observational case series, 657 patients with injury either in one eye or both eyes were clinically examined between 1st January 2023 to 31st December 2023. Out of this, 460 patients were males and 197 patients were female. This is the age group studies. We have found the occurrence of agricultural injuries mostly in the age group of 21 to 30 and 31 to 40 years of age group. Coming to ocular manifestations, corneal ulcer was the highest, 292, that is 44.5%, out of which 227 were male and 65 were female. Then next is the corneal epithelial defect, 122, that is 18.5%, out of which 75 were male and 47 were female. And other types of injuries were penetrating full thickness laceration, embedded foreign body, traumatic cataract, panophthalmitis, some cases endophthalmitis, and chemical injuries only 13 cases, out of which 6 were male and 7 were female. So, injury was more common between 21 and 55 years of age groups in both sexes, which were corroborative with the findings in Singapore study. Males were 74.6% at higher frequency of trauma than the females. Corneal ulcer is a major cause of blindness throughout the world and mostly in developing countries. In our study, it occurred in 227 males and 65 females, which corroborates with the findings of a population-based study in rural South India. So, susceptible population of eye injuries were middle and young-aged working groups, and the proportion of males was higher. The leading two types of ocular manifestations were corneal ulcer and epithelial defect. It is therefore recommended that efforts should be invested in education for proper eye protection in order to prevent ocular trauma in the young and middle-aged working groups. Research and prevention of eye injuries could be further aided by a nationwide collaborative registry of eye injuries in India. These are my references. Thank you.
Thank you, Dr. Ruma. Indeed, this is a matter of concern. Okay.
Could you briefly tell us about the type of injuries? I mean, how many cases did you encounter of fungal, ulcers or bacterial one or otherwise?
Yes, sir.
Because that is more important
Yeah,
now in
since
all
this
these
is
cases of
basically
ocular trauma.
Yes.
Yes, sir.
Because you are talking about the agricultural injury, basically.
Can you
So-
please help me? My slides are not come.
And number two, how about the chemical injuries? What was the nature?
So, corneal ulcer we got 292, and out of which 227 were male and 65 were female, and most of the corneal ulcers were fungal corneal ulcers.
Fungal.
Fungal corneal ulcers.
Because you are from a medical college,
Yes,
could
sir.
you go for which fungus was there?
Yes,
You must have got it.
Pseudomonas. Yes, we did the study. Aspergillus, Pseudomonas.
Pseudomonas is not a fungi.
Not sorry, sir. Aspergillus.
Aspergillus is, yes.
Aspergillus. Sorry, sir. Aspergillus.
How about chemical injuries?
Chemical, mainly lime burn. Lime burn injuries.
We consider kids to be injured. Suppose a 1 year old or 6 months. Have you noted?
Yes, sir. But not is agricultural injuries. Kids are affected by playing with sharp instruments and all. But in case of agricultural injuries, we mostly got patients in the age group of 21 to 55 years of age, working population.
I've seen 2 cases of kids of 6 months and lying in this would be a little tell it, and this beak of bob.
Yes.
Certainly.
Yes.
Trauma.
Lime injury, lime burn
No.
injury.
It's a bird.
I think.
Bird. Yes, sir.
Dr. Shekhar, thank you.
Okay,
Now
thank you.
we'll go the second speaker, Dr. Parikshit Gokte. Yeah, he's there to discuss about the ocular.
Thank you, Dr. Samantha sir, Satanshu sir, for giving me this opportunity. Respected chairpersons, Dr. Gupta sir, Dr. Subuddhi sir, Dr. Nepalia sir, Dr. Sarkar sir. I thought I was just had to make comments on it, so I don't have a PPT. But Dr. Das has an excellent series, a very large series of ocular trauma from Silchar, which is relatively in one corner of the country. But the agricultural trauma that she is saying is still widespread all over the country. It may not, perhaps agriculture may not be having 70% of India's working population, but it still definitely has 40 to 50% of the population. And a lot of them are perhaps amongst the poorest in the country, as the farmer protest shows. So they all come to government medical colleges and NGO hospitals. Very few of them go to private practitioners. In the READ study that was done by AIOS-ARC, it was found that during residency, Indian ophthalmology residents were actually exposed maximum to only 2 kinds of things. One is for cataract and the other is for ocular trauma. So that way our residents see a lot of trauma. But is it that we really inculcate in our residents how to best deal with it? The area where I come from in Maharashtra, as residents, we would see a lot of sugarcane injuries, because when they cut the sugarcane, the leaf of the sugarcane can actually literally slice through the cornea. And they take it on big truck trolleys, the sugarcane. So if there are 2-wheelers, scooters, cyclists, they also get harmed with the sugarcane. Dr. Heralgi from Shimoga has also shown that he has a publication on areca nuts causing eye injuries because they climb up the trees to pick up the nuts. And Dr. Mehul Shah and Shreya Shah also have large series upon how ocular trauma causes traumatic cataract, and they have in fact designed scales to do with it. So we will get to know what is good outcome and what is not so good outcome. In ocular trauma, we have to understand that perhaps trauma does not come to us first. Trauma goes to mostly the general practitioners or the emergency departments, and they are the ones who see it first, and then only it comes to us as ophthalmologists, especially in places where there are no ophthalmologists or the ophthalmologist is very far away. So I think ACOIN can do one thing in its ocular trauma thing, to have more awareness, like Swapnada had that Drishti Drat. We should have more awareness amongst general practitioners, lay practitioners, and in a lot of places it's the Ayurvedic, the homeopathic practitioners, Ayush, nurses, who give the first line of care. Even if they can do two things. One is they are able to differentiate between an open globe injury and a closed globe injury. Because an open globe injury has to be referred to an eye hospital as soon as possible and treated well. For a closed globe injury, even if the referral is done a few days later, it does not make a big difference. And second is not to prescribe steroids, because as ma'am said, there is a lot of aspergillosis, perhaps mucormycosis. And generally, because the steroid antibiotic drops are very cheaply available for 10 rupees, 12 rupees, and the eye becomes white and the pain goes away. So a lot of GPs write that first, or that is the only eye drop they know what to write. And then that causes more of corneal ulcers, which is very difficult to treat. So even if two awareness are done, one is not to prescribe steroids, and second, just to differentiate between an open globe and a closed globe injury, that will go a long way in reducing the morbidity due to ocular trauma. From the community perspective, trauma that way is very neglected because it causes uniocular blindness. So it is never seen much in all the surveys that are done, which look only at bilateral blindness. But as Dr. Das said, in this, most of the blindness is from the age group of 21 to 40, 55, and almost 75% is in males. Now, there is no gender bias in saying, but then at least in rural areas, a lot of men are the bread earners of the family. So if they become blind or they are out of work for whatever reason, it's not just they that are affected, but their entire family is affected in such a way. And they are in their working age group. So in case they lose an eye or something happens, they will carry this burden of blindness for the next 30, 40 years. So that is what makes ocular trauma very important. And thank you again, sirs, for giving me this opportunity.
Dr.
Sir,
Parikh,
I
yes,
want to add one thing. Sir has said in Maharashtra, sugarcane leaf injury is mostly seen. But in Assam, sir, we get paddy leaf injuries.
everywhere. That's
Everywhere. That is very
What
common.
I want to say also, 1 minute, I will let me say. Paddy leaf is very common
Yes,
because
sir.
80% of agriculture workers are in our country, and mostly they are doing the paddy. And first thing, they treat self-treatment the first. Second thing, OTC. What is OTC? Over-the-counter drugs.
Over-the-counter.
And whenever they go to the counter, they get a drug which is steroid combination.
Usually, yes.
Antibiotic combination, that's very cheaper. Hardly 20, 30 rupees. They put that. Then after that, they go to a MBBS doctor also, or homeopathy doctor. Even our general practice MBBS doctors also educated about the ocular trauma, because hardly we speak anything in the MBBS career. They have to also be educated. And fourth, they come to us. By the time it led a lot of complications.
Thank you, sir.
Here I'd like to add what Dr. Parikshit had said, that in Maharashtra, sugarcane injury, crop injury is more common, as you say, pedigree. In Rajasthan, we get number of cases who are working in onion fields. So while taking out the onions or cutting the crop, they get injury. And at times it becomes very difficult as a clinician to start what drugs. So sometimes we have to start a cocktail therapy. I hope some of you may not agree, but the situation compels us to start with antibiotic and antifungal, both locally as well as systemic. So that should be kept in mind while you're dealing with a case of ocular trauma. Depending on the nature, the patient has sustained the injury, you have to I mean, have your own rational approach for all individual patients. You cannot equate all patients together.
And
So
regarding-
every individual patient requires a rational approach.
Using
Regarding-
of cocktail of different antibiotics is very common,
It's very
especially
common,
at primary level or secondary level. Only in tertiary level you go for differentiating.
So we'll
that.
move on to next speaker.
Sir,
Dr.
regarding
Sunil Kumar.
chemical injuries,
Yes.
lime burn is more in Assam because we
And
used to
everywhere,
take
it is everywhere.
betel nut, pan and betel nuts.
Yeah. Betel-
Okay, thank you, sir.